How do you balance vitamin D and sun protection with lupus photosensitivity? Living with lupus means navigating a delicate balance between protecting your skin from the sun and maintaining healthy vitamin D levels. Photosensitivity, or increased skin sensitivity to sunlight, is common in lupus. Sun exposure can trigger flares or skin rashes, especially the classic butterfly rash across the cheeks and nose. At the same time, vitamin D is essential for bone health, immune function, and overall wellness. So how can you get enough vitamin D without risking a lupus flare? First, it's important to understand that sunlight triggers lupus skin reactions because ultraviolet rays cause skin inflammation. To protect yourself, always wear broad-spectrum sunscreens with at least SPF 30 when outdoors. Reapply every 2 hours or more often if swimming or sweating. Cover up with protective clothing, wide-brim hats, and UV protective sunglasses. Seek shade whenever possible, especially during peak sunlight hours between 10 in the morning and 4 in the afternoon. Despite these precautions, some sun exposure is still necessary for vitamin D synthesis. The skin produces vitamin D when exposed to ultraviolet B rays, but in lupus, even minimal sun exposure can cause reactions. Therefore, many healthcare providers recommend getting vitamin D through diet and supplements instead of relying on sun exposure. Foods rich in vitamin D include fatty fish like salmon and mackerel, fortified dairy products, and egg yolks. However, it can be challenging to get enough vitamin D from diet alone, so supplements are often advised. When considering supplements, it's best to consult your healthcare provider for personalized guidance. They might recommend vitamin D testing to determine your current levels and suggest an appropriate dose. Typical doses range from 1,000 to 4,000 international units daily, but your doctor will tailor this based on your needs and blood test results. Regular monitoring helps prevent vitamin D deficiency without risking toxicity. It's also helpful to be aware of other strategies that support your vitamin D levels. For example, some studies suggest that brief, incidental sun exposure, like walking in the shade or sitting near a sunny window, may provide minimal vitamin D synthesis without significant risk of skin flare. But always discuss these options with your healthcare team, especially if you have active lupus or a history of photosensitive reactions. In summary, protecting your skin from ultraviolet rays is crucial to prevent lupus flares. Use protective clothing, broad-spectrum sunscreens, and seek shade during peak hours. To maintain healthy vitamin D levels, relying on dietary sources and supplements prescribed by your healthcare provider. Regular blood tests can help ensure your levels stay within a safe and effective range. Remember, every person with lupus is different, so personalized medical advice is key. Always talk to your doctor before making changes to your sun exposure or supplement routine to ensure your health and safety.